Hello, my name is Andreas Røder. I'm an MD and PhD working at the Copenhagen Prostate Cancer Center and Department of Urology in Rigshospitalet, the largest university hospital in the Copenhagen area in Denmark. I want to thank the BJU Int for giving us the opportunity to publish our data in the BJU Int, and of course for choosing the article as Article of the Week in this April issue. Also, before I begin, I want to express my gratitude to all the co-authors from all over Denmark who put in a great effort to collect this dataset. I'm going to present the data from our article entitled Survival After Radical Prostatectomy for Clinical Localized Prostate Cancer, a Population-Based Study. In this paper, our objective was to describe survival and mortality in the complete cohort of men who underwent radical prostatectomy in Denmark from 1995, when radical prostatectomy procedures were started, up until the end of 2011. I think there are at least a couple of reasons why this publication is interesting. First, it represents a complete national cohort, which in our opinion has not been published before. And secondly, as a consequence, this cohort does not represent a super select cohort from a high volume, highly experienced center. Let's have some quick background information about prostate cancer in Denmark. Although we have several cancer screening programs, PSA screening has never been recommended in Denmark. Nonetheless, as in most other Western countries, the incidence of prostate cancer has increased dramatically since 1995. This, of course, is indicative of ongoing opportunistic PSA testing, and there's no doubt that this was triggered by the introduction of radical prostatectomy in 1995. As demonstrated here, the number of radical prostatectomies performed every year has increased concomitant to the increment in incidence. And we now perform around 1,000 prostatectomies every year. However, we are yet to see a decline in prostate cancer mortality. So let's look at the cohort. A total of 6,467 men underwent radical prostatectomy in Denmark, and these men had a median age of 64 and a median PSA of 8.8. A total of 28% of the patients were categorized as D'Amico high risk. During a median follow-up of 4 years, whereof 440 men were followed for more than 10 years, a total of 328 men died. Not surprisingly, most men died of other causes than prostate cancer. A total of 6 men died within 30 days of surgery, resulting in a perioperative mortality of 0.09%, which is similar to what has been reported in other large cohorts. Putting these data into a Nelson-Allen estimate, the cumulative hazard of all-cause mortality 10 years after radical prostatectomy was found to be 15.4%, and the prostate cancer-specific hazard of death was 6.6%. Now, comparing cohorts across publications is always difficult due to differences in selection criteria, etc. However, if, for example, we look at the data from the radical prostatectomy arm in the most recent publication from the SPCG4 study, we found an almost identical hazard of prostate cancer and overall mortality. So in conclusion, in this complete nationwide cohort of men who underwent radical prostatectomy in Denmark the past 16 years, we believe that results demonstrate that the risk of mortality is equally as good as has been described previously. And these results should be interpreted in the light of the fact that this particular cohort is a very heterogeneous group of men who were operated in both high and low volume centers by multiple surgeons with varying experience. Thank you.